Hello, and welcome to Picking Health Insurance for Your Needs with Justworks. Today, we're going to go beyond definitions and terminology to help you strategize your health insurance selection process for open enrollment. A quick disclaimer before we begin. This material has been prepared for informational purposes only, and it is not intended to provide and should not be relied on for legal or tax advice. If you have any legal or tax questions regarding this content or related issues, then you should consult with your professional legal or tax advisor. To start, my name is Nicolette Graves. I'm the Senior Product Marketing Manager of Health Benefits at Justworks. Today, I'll be joined by Amy Cushman, Program Manager of Health Benefits, and together, we'll be showing you how to strategize and prioritize your picking the best health insurance plans for your needs. Before we start, we want to help you understand what this webinar is and is not. This webinar is an opportunity to become a confident consumer of your health insurance. It is not just a run-through of vocab, but a walkthrough of how to think about health insurance plans in relation to how you use them and your budget. Our goal today is to talk about health insurance in an easy-to-understand way to best support you in decision-making process for open enrollment. Quick tip, pause this video and download the open enrollment guide to follow along. So what is open enrollment?
Open enrollment is the time each year when you can enroll in or make changes to your health insurance benefits offered through your employer. It's an opportunity to evaluate your health needs, both current and upcoming, and choose a health plan that fits your needs, goals, and budget for you and any applicable dependents. But before jumping straight in to choosing a plan, we think it's important to take a step back and look at your health and goals holistically. We know it's tempting to go straight into Justworks and start diving into your insurance offering. However, we also know it can be overwhelming once you get into the weeds of health insurance terminology, HDHP, HSA, deductible, we could go on. Rather than get bogged down in the complexities and nuances of each plan, it may be helpful to first think about what's important to you and your dependents when it comes to having health insurance. These are the steps to open enrollment. The first step is to reflect. A good place to start when beginning the open enrollment process is to reflect on what's important to you. Do you want to make sure that you have the most coverage available? Is it important to make sure that your spouse or dependents are on your plan? What is the consideration of your budget? And do you need additional services like mental health support? Creating a list of your priorities and ranking them by level of importance will help you understand what to look for in a health insurance plan.
Step 2, map. Now that you have a list of priorities and values, you can begin to map services you think you'll need to that list. Start by listing the services you sought out this year, then think about the care you think you'll need in the coming year. For example, maybe you're thinking of starting a family this upcoming year. You'll want to jot down some services related to that, like prenatal care, to look for while going through open enrollment. Maybe you have a recurring health issue that requires you see a specialist. Jot down those specialists that you'll want to check cost and coverage for in your available plans. Additionally, think about what services you did or did not use last year. Was something in your plan last year even necessary to have? Was something missing that you really needed? Mapping your priorities to the services you need will help you create a shopping list, so to say, when looking for a plan. This is a good place to pause this video and take a moment to think about your priorities.
Step 3, compare plan types and networks. Now that you've mapped your priorities to your services that you'll need, it's time to actually start looking at what plans and networks are available to you. Networks can determine which doctors you'll be able to see and what's actually covered when you go. We wanted to start with high deductible health plans, HDHPs. These plans tend to have lower premiums, but in the beginning, you're likely to pay higher out-of-pocket costs. These plans are best when they're paired with a health savings account, or HSA. You can use your HSA to offset the high deductible and out-of-pocket costs associated with these plans. The benefit with an HSA is that you can contribute money from your paychecks pre-tax towards this health savings account. And like it sounds, this is a savings account that's absolutely yours, which means that even if you change your employer or ultimately later change your plan, the funds that you've contributed to your HSA are yours forever, and they go with you wherever you go. So all the pre-tax dollars that you're able to contribute are yours so long as you should need them to contribute to your health insurance costs. The network type of an HMO stands for a health maintenance organization. So HMOs tend to have lower out-of-pocket costs. The way this works is that you typically have a primary care doctor who coordinates all of your care. However, that also means that you have less freedom to choose your own providers. If you don't mind your primary care doctor choosing your specialist for you, then this is potentially a really great plan for you. The one thing to note is that HMO plans don't necessarily have any out-of-network benefits, of course, unless it's in case of an emergency. But what this means is if you're currently seeing a provider that you love, you definitely want to make sure whether or not they're participating in the HMO in order to make sure that you can continue to see them. EPOs function similarly to HMOs. They similarly don't have out-of-network benefits, but they tend to have lower out-of-pocket costs. The nice thing about EPOs is they're not as tight of a network. You can certainly go and see specialists and choose the specialists you'd like to see, and you'll be covered so long as they're in network. You'll still get a primary care doctor, and they're still more than happy to coordinate your care. It's just that this plan definitely allows you a little more freedom. The last type we want to mention is a POS, or point of service plan. With POS plans, you'll typically have more provider options. Again, you can also get a primary care doctor who will help coordinate your care and give you referrals if you want, but you're certainly not required to get a referral from your primary care doctor to see a specialist. POS plans also have out-of-network coverage. So again, if you have a provider that you're currently seeing who doesn't participate in the carrier's network, this is a plan you might want to make sure that you're looking at. Or if you have children's doctors who are outside of this provider, or a spouse or a partner who has a provider that's outside of the network, you'll definitely want to make sure that you take a look at these types of plans, as they have out-of-network benefits, which is something that's a benefit outside of the others. That being said, because of the flexibility and the choice in a POS plan, it's important to note that those are likely to have higher monthly premiums. So it's something you'll want to consider when you're weighing all of your options and thinking about your budget. So using this understanding of networks, you can now use your list of priorities to figure out what plan type makes the most sense for you in the upcoming year. You can start by matching your top needs with perhaps the ideal network type, and then figuring out what that means in terms of the care and budget and things that you'll need in order to make sure you're set up for the upcoming year. It may be helpful at this point to take a pause, visit your benefit center, and take a look at what networks your employer is providing access to.
Step 3, Part 2, compare cost. To figure out which plan best fits your budget, you should calculate the potential costs of the plan, options, and networks available to you. To gauge total potential cost, find the sum of the plan's out-of-pocket max, how much you'd pay out-of-pocket for covered services before insurance begins to fully cover the costs, and annual premium. First, for each plan that you are considering, take note of their premium, deductible, coinsurance, and out-of-pocket max. The premium is how much you pay a month for your health insurance. This is taken out of your paycheck on a semi-monthly or biweekly pre-tax basis. Deductible is how much you pay out of pocket before your health insurance starts to pay. Typically, copays will not apply toward your deductible. And there's your coinsurance, which is a percentage of the cost of service or fee your insurance carrier will cover after the deductible is met. And then there's out-of-pocket max, which is the most you would have to pay for qualifying services in a calendar year. The insurance carrier covers 100% of the cost for qualifying claims after this amount is exceeded. Once you've met this amount, the carrier will generally cover 100% of those subsequent procedures and charges. These numbers ultimately determine how much you'll potentially spend on healthcare for the year. Then, to gauge total potential cost, you'll find the sum of the plan's out-of-pocket max. Again, that's how much you pay out of pocket for covered services before insurance begins to fully cover the costs in annual premium. So what you'll do is you'll take the monthly premium, multiply it by 12, aka 12 months, then add it to the out-of-pocket max. The sum is the max you'll pay before health insurance kicks in. This is a great exercise because it shows that you may not need the richest plan to cover the services you need. It's very possible that a more affordable plan can cover your needs for the plan year depending on your situation. It's important when comparing plans to take a look at all of your options with a list of priorities and services mapped out. Health insurance at Justworks.
As an employee on Justworks, you have access to additional services and providers to help support your health benefits that go beyond just your actual health insurance plan. Here, we have a few additional services that you have access to if you're enrolled in a health insurance plan with Justworks. The first we want to highlight is Talkspace. Talkspace is great because it's therapy on your time. They have high quality and certified providers, and it's smart and easy matching. You can tell Talkspace what it is that you're looking for in your therapist, and they're able to match you with therapists that specialize in those areas. It is a service that makes accessing mental health care and support easier. So if you enroll in any medical insurance plan through Justworks, you'll receive 3 free months of Talkspace to use at any point between November 1st of this year and all the way through October 31st of the following year. So October 31st, 2021. The next one we want to talk about is One Medical. So One Medical is a membership-based primary care practice that provides amazing quality and accessible care. I personally love One Medical, and I would recommend that if you're enrolled in one of our Justworks medical plans, that you also get enrolled in One Medical. If you're enrolled in one of our plans through Aetna or United Healthcare, you actually have access to a free One Medical membership. They're the nation's leading on-demand primary care provider with appointments that start on time, and they have an easy-to-use app where you can complete things like scheduling an appointment or requesting a prescription. In addition, this year One Medical is excited to offer One Medical Kids. So if you have any children on your medical plans, you are certainly more than welcome to take them to One Medical for any of their pediatric needs. The last we want to highlight, but certainly not the least, is your access to Health Advocate. Health Advocate is a leading clinical health advocacy company. With Health Advocate, you can get help finding doctors and hospitals. They're a resource for negotiating medical bills, and you can actually also get access to mental health services and grief counseling. And they'll even help you with things like work-life balances or financial planning. Health Advocate's a great resource if you have any specific questions about your options in Justworks. And it's free to your family, even if they're not enrolled in your plan. So now that we've walked through how to think about your health insurance and additional resources you have, let's take a look at how this framework might pan out for a few people who are going through open enrollment this year. We're going to take a look at Michael. You could think of Michael as the savvy saver. He's very conscious of his budget, and he knows his employer is offering access to an HSA. In terms of his care needs, Michael wants to make sure that his preventative services are covered with no questions asked. In addition, Michael also knows that he wants to make sure he has access to mental health services. So when Michael maps this out, what he's thinking about in his budget is he knows he wants to reduce costs. So he has to consider both his monthly premium and his out-of-pocket maximum. So if he's looking at the total year, how much does he know he's going to have to spend out of his paycheck for his monthly premium versus how much does he think he'll use in care, and what would the out-of-pocket maximum be in that case? In terms of care, Michael needs to check that everything under preventative care or routine checkup is going to be covered for him each year. And he wants to figure out what the cost is if he needs to go get any of that care. For mental health, Michael knows that he wants to see a therapist in the upcoming year. So this means he probably wants to get access to specialists. He might want the option to choose his own specialist. And these are things that he's going to think about when he goes through the plan details and looks at, the cost and the ability to see specialists. Now that Michael's mapped out everything, he can start to compare the actual plans he has in Justworks. The first thing Michael compares is his budget. So he's going to look at the deductible, his co-pays, and also potentially his out-of-pocket maximums. In addition, he might want to look at the premium for, what it costs each month to be enrolled in these plans. It looks like for Michael as an individual, all these plans are at $0 cost to him. So he might now want to focus on, what are the deductible and out-of-pocket maximums for these plans to figure out what best makes sense for his budget. The next thing that Michael's going to look at is the care. So he's going to take a look at the network type. It looks like Michael has access to the POS network and EPO network, which, as a reminder, doesn't have any out-of-network coverage. And it looks like he's also got access to a POS plan that's a high-deductible health plan, meaning he might get access to an HSA. The next thing he's going to look at is mental health services. Looks like Michael will have to download the plan details, which are available for all the plans available to you in your benefits center, to get a better understanding of what's covered. Also, Michael realizes that he's got access to 3 free months of Talkspace, and so he might factor that in when he's looking at the plan details in terms of what's covered for mental health. He also notices that his employer is offering access to a health savings account with his high deductible health plan. In this plan, Michael can set aside pre-tax dollars to an HSA that never expire. It's helpful for him because he doesn't foresee needing to see the doctor aside from all the preventative care, and then he can take advantage of the pre-tax benefits of having an HSA. Now let's take a look at Katie. You can think of Katie as very family focused. For care, it's very important to Katie that her and her family can access the care that they need. In terms of budget, Katie wants to do anything she can to save money on her children's health expenses this year. Now that Katie has figured out her priorities, she can map them to the services she needs. For care, Katie wants the ability to pick the doctors that she wants for herself and her family. She wants to make sure that the providers her children already know and love are still going to be covered in the new plan that she chooses for the upcoming plan year. On a budget, Katie wants to make sure that she's saving on her monthly premium if at all possible. She's also hoping to utilize an FSA or a flexible spending account to pay for her children's medical expenses. Finally, Katie compares. Katie jumps into her Justworks account to take a look at what she has available. For care, Katie notices that the EPO network doesn't let her see out-of-network providers. So that's certainly something she's taking into consideration, and she might even mark that as totally not an option for her and her family for this upcoming year. For her budget, Katie considers, again, the deductible, the out-of-pocket max, and also the monthly premium for both Katie and her family. By using this framework, Katie is able to prioritize her needs, so finding care, and then also digging down deeper to the cost considerations for plans that are meeting Katie's needs. Based on these decisions, Katie's leaning towards probably selecting the POS plan shown here. Though it's a little bit more costly, she'd prefer the peace of mind of having a primary care doctor help her coordinate her children's care, while also having the flexibility to see out-of-network providers of her choosing.
In summary, this is really just a starting point. The framework we discussed is a method you can use to begin selecting your health insurance for the new plan year. There are other factors you can consider when selecting your plan, but we hope this framework will help you think about your selection in a new way. For more guidance and help, we've built an open enrollment landing page where you can access this recording, a PDF to walk you through this framework, and additional information about common health insurance definitions and scenarios.
We want to thank you so much for joining us and spending your time with us today, and we hope this was helpful. We want to remind you that open enrollment is right around the corner. It begins on September 22nd, and it ends on October 1st. So don't wait. Make sure you're logging in early and taking the moment and chance to go through all of these steps and really figure out what's important to you so you can make the right decision for you and any loved ones for the upcoming year. As always, we're here 24/7 to help, so please feel free to reach out to us at any time for help selecting plans, understanding your options, or whatever else comes to your mind.